Welcome. My name is Marissa Gilman, and I lead Global Health at Resonance. We're thrilled to host our guests today from the Global Fund, the Novartis Foundation, Rwanda's Ministry of Health, and Microsoft as part of the Inclusive Innovation Exchange. In this conversation, we'll look at how these leaders have built digital ecosystems and fostered cross-sector partnerships with each other and with others that promote health access. If you're unfamiliar with Resonance, we're a consulting firm that supports change makers in collaborating and innovating across sectors to create meaningful impact. Inclusive innovation is a key part of this, which we define as innovations that are local first, human-centered, and rooted in partnership. We've had a variety of past discussions on this topic with recordings and summaries on our website. This will be an amazing conversation, and I'm sure it'll spark questions. Please submit any questions via the Q&A button on your Zoom screen, and we'll select a few at the end during the last 15 minutes of our chat. So with that, I'm really excited to introduce our four guests today. First, we have Ashlyn Quirk, who is a private sector portfolio manager at the Global Fund. She co-creates partnerships and innovative financing with the private sector to strengthen health systems and digital health solutions. Next, we have Anne Arts. Anne is the head of the Novartis Foundation, where she works to improve population health through data, digital solutions, and artificial intelligence. Anne chairs the Broadband Commission for Sustainable Development Working Group on Digital and AI in Health, and is a member of the International Advisory Board of the Commonwealth Center for Digital Health. Next, we have Baptiste Birigiro, who is the Chief Digital Officer of Rwanda's Ministry of Health. For the past 10 years, Baptiste has led e-health initiatives within the ministry, including the deployment of the country's electronic medical record system. And last, we have Vikram Dendi, who's the Chief Product Officer for Microsoft's Research and Incubation's Health Futures team. Vikram represents a Microsoft-wide coalition that's working to transform health and life sciences for better healthcare worldwide. Thank you so much for joining us, and I'm thrilled to start the conversation. So let's dive in. Our first goal of this conversation is to understand how to create conditions for digital health innovation and collaboration, particularly in low resource environments. Based on all of your experience, what do we or countries need for successful development, adoption, and scale of digital health? And Baptiste, this seems like a good question to start with you due to your experience in Rwanda.
Thank you very much. Thank you all. Good morning. Good afternoon. So the experience of Rwanda for a successful digital health solution, first of all, the health sector engagement together with the private sector is crucial because if, for example, you want a successful digital solution, you need to engage all stakeholders. The second thing is to maintain the patient focus. You know, whatever you do, you need to orient to the patient-centered approach. The third one, you need to have a sustainable financial to maintain the digital health solution. The fourth is to have a local skills in the country to maintain the digital solution. And then when it comes to the implementation, it's better that you start in a phased approach. In Rwanda, we did it because, you know, from the experience from different pilots, it's when you get the input to go for rollout. The last one is when you select a solution to be implemented in Rwanda. For example, the most of people, they are being driven to the prices, but also we need to have a solution which is proven with the several successful references and have a technical viable as well as have a strong support. So I think if you manage to do all of this, like we try to do, and then you have a successful digital implementation. Thank you.
Thank you, Baptiste. It's really helpful. And I think that the patient centricity as well as having technical viability is something that I'd imagine everyone else has had to prioritize as well. And Anne, I'm curious how the Novartis Foundation has thought about how to deploy digital health solutions successfully in country.
Yeah, I think Baptiste has mentioned most of the really important elements, and I cannot agree more that first and foremost, we search to include the needs of the end user. If you don't have that view of people who will have to apply or use the solution, it will never get to scale. But another thing we've seen in all of our experiences with rolling out digital solutions, if you want to get them to scale, the simplest solutions are the ones that make it to scale. So a good example is telehealth, for example, in Ghana, which we started more than 10 years ago. It was the simplest solution you could imagine, really performing virtual health services by phone and coaching community health workers or less skilled health workers on the ground through phone calls. Afterwards, you adapt it to the existing infrastructure. When WhatsApp became available, we could use pictures or small videos to improve the services and so on. So you really need to use the simplest solution possible. Many patients were illiterate, and you need to use voice messaging instead of SMS or text or WhatsApp. So it really depends on what the people who are living in the places where you roll it out and who use the solutions really need. But I think another very important component is also what you mentioned as the first one, but it has to be a public-private partnership. Because if you don't engage the government, specifically in countries where the main health providers is the public health system, you have to engage with the government upfront and include them in the selection, the design of the solution, to make sure that it gets to scale and gets integrated in the health systems. And there, Rwanda plays a really incredible role. We just launched a month ago the Health Tech Hub in Africa, together with Novartis Foundation and the Novartis Foundation. This Health Tech Hub is hosting 30 startups with new ideas, but not really very early ideas, but already validated ideas to get them better in their business plans, get them connected to more investors, and also further grow their solutions and validate them. And what does the government of Rwanda propose? In this case, to support this health tech hub in Kigali, the government of Rwanda really wants to support the startups with those solutions to validate it further within their health system. And that's a fantastic opportunity for startups to grow and to really make sure that their solutions correspond to what people need. And lastly, I am very much in favor that every solution has to be needs driven. It cannot be a solution driven approach that you take and come with a beautiful technology to a certain country and say, wouldn't you like to roll this out? No, the country has to identify what its priority needs are, and then you develop a solution that responds to those needs. That's for me also a critical condition for success.
Thank you. And it's really helpful. And it's so important to reflect on the power of that public-private partnership, which is why all of you are in this discussion today. And that actually leads me to Aisling, because I'm curious, since that is your vantage point at the Global Fund, based on your experience, what have you seen that we need to successfully do digital health, perhaps with that lens of the power of partnership?
Sure, thank you, Marissa. So, I think building on many of the points that were made, I think, first of all, to say that there's really been an explosion of interest in digital health, right? And the rollout of digital solutions. And this is really exciting to see. I think the flip side of that, what we've seen is that, sometimes those systems or solutions that are rolled out are not interoperable, right? So what that means is you have lots of different solutions, which are, maybe great in their own right, but they're not connecting to allow ultimately data to flow across the healthcare system. And I'm sure Vikram will touch on this. So, so a key, success factor in our view is how you drive that interoperability across the health ecosystem. And to get there, standards and data and interoperability standards are really key. And Rwanda is a great example of a country that has a very ambitious vision with regards to digital health, but really decided to start by putting those foundations in place by starting with defining data and interoperability standards. And we had the privilege to support that together with Microsoft and MasterCard last year. And so I think all of that to say that it's about starting, not losing sight of some of the foundational elements. And secondly, bringing in different players who can bring different expertise on that journey. And I think just the other, and I'm sure we'll talk a little bit later about who are some of those different actors in the health ecosystem. But I think one that's very important, when we talk about data and digital health is also civil society, right? And the Global Fund, as you know, is a partnership between private sector, public sector, civil society. And I think, when ultimately we're talking about very sensitive data, health data, it's really critical to ensure that we put privacy and integrity at the heart of the solutions that we're designing and rolling out. And so civil society can play a really important role in also representing the voice of the patient, at the table.
Thank you, Aisling. And it's the focus on the foundational elements of what is needed for digital health actually is what sparked this webinar to begin with. So I really appreciate you bringing that up. And that actually leads nicely to Vikram, since I know that Microsoft has been thinking a lot about what is needed to create the enabling environment for technology and for digital health more broadly. So I'd love to hear your perspective on what we need for success in this space.
Thank you, Marissa. And I'm actually glad to be going last on this question, because I think our friends, Baptiste and Anne and Aisling have really touched on the ground conditions really needed, and also kind of the ordering of how you want to go after the big challenges that exist right now. And there is always this interesting dichotomy between, whether how to approach it, how to create the right simplicity in order for greater adoption. But we also know that some of the biggest problems that exist that haven't been tackled or that are still ahead of us will require more complexity, whether it is more complexity in technology, whether it is more complexity in business models. So it's been really an amazing journey with partners like this to try and understand how to create the ground conditions, what kind of technology capabilities need to exist in order to go from that, those initial simple interventions to things that are that can take on the bigger ones. And as Aisling said, some of the challenges come from things operating in silos, and it's not just the technical aspects of it. And so there is a role that I think the governments get to play here, because ultimately the thing that everybody should be incentivized around is how to think of this in the long term. I think the main distinction often comes when, if private sector is thinking somewhat near term, and the other players, have different time ranges of how they are optimizing for impact. How do you bring all of that together and try to kind of align them so that we can sort of have greater ambition? I think specialization, taking tech as an example, specialization has a tendency towards creating siloization. Ever since the Industrial Revolution, the more specialized you get, the more deeper you go, the more you constrain a problem. And so that inadvertently can create fragmentation people will look at a particular problem with a particular lens and actually like try to solve it from that context. But oftentimes that takes away from the human centricity that we are talking about. And a great example of something that countered that during the last couple of years was sort of this crisis of pandemic. And when you look at like how vaccines ended up getting developed, or some of the antiviral drugs getting developed, this was the work of specialists, but it really required a massive partnership, and so many problems to be solved from so many different directions. And so that gives me a lot of optimism for this. I think having technology foundations that are resistant to siloization, interoperability standards, government policy that optimizes for that and encourages greater collaboration. These are all things that need to be the ground conditions so that we can all start imagining things more ambitiously.
Thank you. This has been such a great way to start the conversation. What I'm hearing is the importance of being patient-centered and rooting our solutions in the needs that we're actually observing in each of these regions, of testing and piloting and adapting and rapidly iterating, of collaboration and coordination, both within the country, across systems within governments, but also outside, and thinking about how to collaborate with civil society, with private sector, with other players that are all trying to solve these similar challenges. And it leads to a question, and this conversation is an optimistic one. We are all very excited about where we're going and what we can do in digital health. For us to be able to move forward, we do have to have eyes wide open in terms of the barriers that we see. And I'm curious what you all have experienced that are getting in the way of successful digital health initiatives that you've tried to roll out. And perhaps, Anne, we could start with you on this question. In the work, you had given some examples, the work that you've rolled out in the Novartis Foundation. I'm curious, what challenges have come up that would be helpful for us to address in future digital health solutions.
Yeah, I think if you look at the complex problems we try to solve, as you rightly say, everything becomes more complex. So the solutions will also become more complex, and that's too much for one single player to address alone. It's really impossible. But what we see in even simple solutions currently, the main barrier is, there's two for me. First and foremost is the digital skills of people, the workforce, government leaders, this has to be increased worldwide. And that's not only in low and middle income countries, it's also in high income countries. We've seen the resistance in the beginning of the pandemic against the virtual health and care services, even in the UK, because there was a lot of skepticism around it until the benefits far outweighed the risk and everybody shifts to it. But we've seen also, we are currently working with the Broadband Commission working group on digital and AI in health on a new analysis, and that's really looking at how COVID accelerated the use of virtual health and care services and what countries did that were most successful in making such services available. Because we've seen many countries that lagged behind because they had too stringent regulatory systems or governance systems and couldn't adapt fast enough, where you've seen countries like the US, France, or many countries have increase their virtual health services used by 2,000, 3,000, 30,000 times, where other countries such as South Korea had very stringent regulations and couldn't really start fast enough. So it is really an important aspect. If you want to be fast in a response to a crisis, you have to be agile enough with your national ICT, let me say, framework, your regulatory, your governance systems, and your interoperability standards and all of that, or it won't work. And what we've seen with this landscape analysis on the case studies on that specific topic is that a main problem during the pandemic, and that where the spotlight has been put in every space and every country on that problem, is the inequity. So you get unequal access first and foremost to broadband. Still, before the pandemic, half of the world's population was not connected. Currently, during the pandemic, that has decreased, luckily, quite significantly, with currently only 36%, I believe, that is still non-connected, but that is a major reason for unequal access to broadband and to the services it can deliver. And another one is that not all the solutions that we bring to the markets are available to people with disabilities or people from elderly people who are very much excluded from services. And so the unequal distribution of these beautiful technologies, the use of it, the unequal use is another main barrier for me, besides the skills. But the skills would be the main one.
That makes sense. Yeah, we need to have a workforce and a population that understands how to use these technologies, but then also has access to it, related to the work that you're doing on the Broadband Commission. And Baptiste, I'm curious what you have seen in your over 10 years of working in this space. What are a couple barriers that have stood out to you that have hindered digital health rollouts?
Yes, thank you. If I may group this kind of challenges in 3 categories. One is having a neighboring infrastructure, which is very critical because to be able to implement digital solution in large scale, you need to have this infrastructure and the IT equipments. And this has been a barrier for us during our implementation, having enough machines, local area networks, and also as you may know, the internet has been implemented, has been expanded gradually, and the fiber for having the broadband, you know, implementing like a telemedicine or any system that require to have a strong internet, you need to have those kind of fiber optics implementation. So the another challenge is related to the capacity, as Anne touched on. So first, when you implement any technology, there is always a change management or any behavior of a clinician or any health provider to embrace technology. The adoption has been a challenge. And also this adoption goes with computer literacy as well. Another thing related to the human resource is to have enough capacity, local capacity team to maintain that solution. So the third one is related to the technology itself, because when we implement the digital solution in Rwanda, we found a lot of silos system. And this multiple reporting system, which sometimes impose our health providers to do a multiple reporting and double reporting, that has been always a challenge for Rwanda. And I think most of challenges were related to those 3 categories: infrastructure, human resource, and the technology itself. Thank you.
Thank you, Baptiste. And Vikram, this is what I'm hearing from Anne and from Baptiste, the challenges around skill building, around infrastructure, around internet access. These are all things that I know Microsoft is also thinking about. So I'm curious what your perspective is here as well.
Yeah, I'll just touch on one of these. And this is, this actually has this, highlights this very unique property that health has compared to anything else. That is that it can be hugely personal, right? Highly personalized to each individual, but it can also be huge, have a huge effect on the overall health of the human population, right? Like, understanding your health actually gives not only a better understanding of what you need to do to be healthier, but it also can give a great understanding of how humanity can be healthier. And so there is a lot of value there in furthering human health all up. And right now, the data that will transform healthcare is scattered across that fragmented ecosystem that Baptiste talked about. It's locked in silos within our institutions and in forms that are not accessible. So if nothing changes, that data will not point us towards new diagnostics, new therapeutics, or vaccines, and or all the way on the other end of the spectrum, even how to make your life better, how to have a more holistic view of you or of your family, the risks that that affect you. And so it's actually, so on that front, like just that one, if you just focus on that one for a moment, it is essential to create a future where all of that data can flow freely and securely across the healthcare ecosystem, making it much easier for patients, providers, researchers, scientists to share information and drive innovation. And this partnership, like what a lot of the work that we've been doing together with Global Fund, Novartis, and actual sort of hands-on folks like Baptiste, has been about making it making the investments needed for digital health data and the infrastructure that handles it to be stronger, to have the right kind of industry standards related to security, privacy, and compliance, and including supporting healthcare data protection laws that meet citizens' expectations and reduce barriers to innovation. I think digital gives you a lot of tools for it, but you also need to kind of put that together with intent and some amount of planning.
Thank you. Vikram, I want to stay on that thought because I wanted to transition to some of the solutions that you all have taken to address these challenges. And you just hit on one, which is the partnership that you have been forging with these players. And I'm curious why, why did we decide to use partnership as a way to solve these challenges?
Yeah, maybe I'll go first, and then in one of our discussions earlier, there was a proverb that came up about if if you want to go fast, go alone, and if you want to go far, go together. And it really stuck with me, and I went and did some research online, saying, where did this come from? And it has a really interesting history, and no one knows actually who it actually came from. But one leading thought is that it's an African proverb, and so I will take that, given the work that we've been doing. The point though is that for the challenges that exist in healthcare, we have to actually go far and go fast. And so I think a lot of what we have been looking at, right, like what digital can do when applied the right way, and what innovation can do beyond just the tools and technologies, but also around business models, around incentive creation, and so on. That I think is going to be super critical for us to be able to get there. And every level of healthcare, there is something associated with being part of a community, right? Even an individual is part of a community called a family, and knowing, how you think about your healthcare and how your healthcare affects everybody around you is so critical. So I think it's super important, and I cannot think of a better way than partnerships to actually make things patient-centered, and be able to think about how to solve some of the really enduring challenges that we have had to deal with so far.
Marisa, if I may add something there, because Vikram, you really hit the the nail there with the question on data and health data. How can we better use them to drive innovation? Because that's what we need to address all these main global health challenges we are facing today. And it's impossible to do that alone. And that's where you need to bundle the expertise of different partners, like between a tech company and a healthcare company and a government, and who else would be around the table. But what we are driving together with Microsoft currently is this data collaborative for cardiovascular population health. And of course, there's many data collaboratives existing, but they mainly look at medical care, at clinical care. What we aim for with this data collaborative is really bringing together data that exists and sits in silos. We work with, thanks to the fantastic technology capacities and computational power of Microsoft, and analyze that to understand whether we can develop tools or solutions that help policymakers deliver better policies or making better decisions when they have to allocate their scarce resources. But you need the data to do that. Without data, we can never address all the challenges we're facing today. And it's even more important than the technology. You will need the technology to roll the tools out afterwards. But the data, the massive, the big analytics around that, and the massive opportunities those bring to deliver new insights for better decision making in health policy and population health. Thinking about your community, yes, this is so important. Your health influences that of your community. We are working with high-income cities currently that have a wealth of data and are having a keen appetite to analyze how they can address health inequities that have been increasing so much during the COVID pandemic. We work with New York City, with Singapore, with Lisbon, with Helsinki. We want to understand what is driving most these outcomes. Why is someone living in zip code so much, XYZ, having 20% higher risk of having a stroke or a heart attack than someone living in the zip code next door? It is really not understandable, and we don't want to continue like this. We have to understand it better, and that's where these massive partnerships have to come to. That's why I very, very much liked your point on data and how it should become available to use for further research and innovation. It's so important.
Thank you for that. And as a reminder for the audience, feel free to enter any questions, because I'm sure these questions are coming up for you all as we're listening to our speakers. And just to what I heard there as well is, it's a question for health overall. It doesn't matter what country you're in. Health is intersectional, and we need better data, period, whether you're living in a major metropolis or you're living in a rural community. How do we ensure that we have the data, and then that we're partnering with the folks who know what to do with it and know how to harness it? And then we're collaborating with governments and roles like Baptiste to make sure that we have the infrastructure to be able to do so. And Aisling, I'm curious what your perspective is from the Global Fund and the partnerships that you've managed working across civil society and others. How has partnership been effective for you all in achieving your goals related to digital health?
Yeah, sure. I think very much for many of the reasons that that my co-panelists have raised, right? It's an enormous challenge, right? To harness data, the data we need and the quality of data that we need, and then to support the flow of that data through the healthcare system, right? So there's many different partners that that play a role. We see the private sector as playing a critically important role in that. I think, it's important also that we allow partners to bring what they do best, right, to the table, right? So if we have if there's technology and solutions and data standards out there, which with the right adaptation can support countries who are building out their digital health ecosystems, then let's harness that. But equally, let's ensure that that is done with a transfer of expertise to local partners, to ensure that these partnerships contribute to sustainable development of digital health ecosystems. And just I wanted to pick up on, if I may, on Anne's point around just I guess the role of data. And for policy making, I think it's really important, and COVID has shown us just how powerful data is to manage diseases, whether it's the pandemic that we find ourselves in or other diseases, cardiovascular, malaria, TB, etc. I think the big challenge that we see as the Global Fund today, and also what drives us to partner with some of those around the table and others, is how do we get access to timely data, right? Because right now, the data that we're using to make big investment decisions around TB, AIDS, and malaria is often 18 months old, right? That's not acceptable. You don't run a business with data that's 18 months old. We see that we have the tools out there. COVID has shown us that we do have the tools to access timely data. So how do we harness those tools to apply those to some of the the endemics that we still need to eradicate? And just lastly, this comes down to also the role of enabling community health workers. Community health workers are at the face of fighting this pandemic and other pandemics. They're the face of our disease surveillance systems. So, enabling them and giving them the right tools to really collect the data is really critical going forward.
Thank you. And lastly, Baptiste, I'm curious your perspective partnering with others, as a government entity, how do you think about partnering with civil society or with foundations or with folks that are outside of the context of Rwanda in order to achieve your own goals for digital health within the country?
Thank you. I think the partnership with different stakeholders had helped a lot for Rwanda to move forward in terms of digital health implementation. As you know, through this partnership, it's where we get those startup technologies through this. And a good example is a Novartis Foundation, and those partnership. It's where we pull some relevant software application to help in our ecosystem. So also the funding. So this kind of digital health implementation, it requires a lot of money, and sometimes if you don't have those partnerships, you can't implement and scale up the solution at large scale. As well, we used to, as Rwanda, we are also gaining a lot from our partnership, the different skills through the TA, technical assistance. And it helps a lot because, we are getting different expertise, and then those people, they work hand in hand with the local teams and then make sure that we gain enough knowledge to sustain our digital solutions. Also, that we are getting different in-kind donations or in different ways. So all of these really, they are the potential to have a successful digital implementation. So in brief, without having this partnership, I don't see the great or successful implementation, because being private, being social, different societies. So they have to be involved and make sure that the solution you're implementing is serving all citizens. Thank you.
You know, it's interesting. We're seeing some questions come in about how to manage these partnerships. And this is something we had talked about in prepping for this conversation, because different sectors have different priorities. And I'm curious what your experience has been for the group to manage competing priorities and competing interests. And with that, perhaps I'll start with Aisling, since this was something I know had come out previously.
Yeah, sure. I think ultimately it starts with something that Vikram touched on earlier. I think it's really by encouraging, first of all, I think picking the right partners, right? So really identifying partners who do have a long-term vision, and who are, prepared to embark on the journey with you, because there's always going to be ups and downs on any journey. And I think, so with the goodwill to really commit, to exploring what, can be mutually beneficial, I think you just manage to work out where there's competing interests, right? But the other thing is, I think it's just being very upfront and explicit around why you're getting into a partnership. I think it's really important that every partner has skin in the game, right? And that includes an interest and something to get out of the partnership. So I think being really upfront about that, and keeping that a live conversation is important. But curious to hear maybe from Microsoft, given that I think it's much easier to say that from a donor side than from a commercial seat. So I think it'd be great to hear from Vikram, your experience of being part of our tech collective, right, with the Global Fund, where you are together with some of your competitors in cloud technology, for example.
Yeah, I mean, by no means is this a solved thing. This is definitely a work in progress. So, I think what's been really wonderful and very important, as Aisling put it well, you want that long-term outlook. And in some ways, at any given point in time, there are certain organizations that are situated in the right place to actually go on that journey. Whether they have business models that are sort of compatible with being able to think long-term in this way. So if there is good alignment that way to the core sort of philosophy, mission of the company, that helps a lot. So I think across all the partners that we have been working with, the thing that really stands out for me is there is a sense of there's a shared sense of aspiration and optimism for what needs to happen. And then there is a ton of creativity, the ability to actually operate internally within their organizations, to describe the opportunity in terms that are well aligned to how the organization knows how to think. And so in that sense, to some extent, I would say I'm privileged and lucky to be at a place like Microsoft at this point in time, because I think a lot of what we have been doing and what we've been thinking about aligns very, very well with the kind of the mission of the company and the business models that are associated with the mission of the company. So to me, it is still a challenge, right? It is to try and get a lot of the big engines of the company that are really working on amazing things like confidential computing and to be pointed at the health problems, the health opportunities. That's still a lift, but it is a little easier just because of that alignment. And you know, I think it helps a lot also to have examples, have like-minded partners that are also going through the same journeys, because you know, sometimes it's way more effective for me to ask Anne to come and talk to, you know, our senior leadership than me just saying, hey, look, this is not just a philanthropic thing. This is actually, you know, much more than that.
And I'd see you.
I wanted to, Marisa, if I may, I wanted to add for the way we approach building these partnerships, and they are always complex partnerships, and you have to nurture them the whole time. But the way we approach it, whether it's a partnership with the government and us as a private sector player, or whether it's with another private sector player or all together, the first and foremost important thing we start with is what you just described as alignment, that you really need to agree on the same goal. If that's not agreed, you cannot even start. But then also, once that's agreed, we sit down and we look at how we are going to jointly address the problem. How are we going to design the solution together so that everybody, as you say, Ashlyn, puts his skin in the game. It's so important, this co-design phase, thinking about clarifying the problem and then really building on how the customer or the user will have to use the solutions. That's really an important phase. And thirdly, as important as the other two are, is the shared measurement. You need to follow your progress. You need to follow up really strictly. Like we are drilled in the private sector to do that, to get your deadlines built, and you are monitoring your milestones and your deliverables. And it is something that when we work with public sector partners, that kind of skill building is something they very much appreciate as well. But still, we monitor the progress together so that we measure success and we can readjust where necessary as early as possible. And working with real-time data, as you said, Ashlyn, it's really scandalous that many countries still have to work with 2-year-old data in the health sector because you get the report so late. So working with real-time data requires also not only a better data infrastructure and possibility to do so, but mainly a mindset shift in the way of working. Because we've seen that also in our work in Brazil and in Africa as well. But let me talk about São Paulo, where we are implementing an urban initiative in a megapolis like São Paulo with 16 million people, I believe, where we sit down with the city authorities and our partners, and we really want to use the real-time data that comes out of the initiative that is run in the public health system. We use that real-time data to redesign interventions. So we saw, okay, we have a lot of patients in the system, but we miss a lot of patients with high blood pressure, for example. We realized in the number we would expect to see in the system was only half of what we saw in the system. So we have to find them somewhere else. Then we dig deeper in the data and see, okay, we are missing the man, because the women, they present in the health services when they are caregivers for their kids or for themselves or for their parents, but the man, the younger man, they don't present in the health system, so you don't diagnose them. So what did we do? The government really proposed that to go to the main football stadia in Brazil and really make that population group of young men aware that they have to know their numbers if they want to decrease their risk of doing strokes and heart attacks. So we work with football stadia, samba clubs, metro stations, and that's how we then identified more patients. Once that was done, we see in the data that it's fine to have more patients, but if they all give up after a few months on their treatment, you need to find them back. So we find new solutions. So it's a constant measurement of progress and outcomes of your work as a partnership. And that is really crucial, but it requires a mindset shift that when it's there, you get massive results. In 1 year of implementation in a city like São Paulo, we reduced the strokes by 15%. And that's massive for a government. So if you understand that when you work in a really aligned way with public-private partners, and you measure really strictly what you're doing, you can get fantastic results. And that's on an optimistic note. I wanted to end on the partnerships, but it's really important.
Did you want to add something? I saw you went off mute.
Yeah, I think that just to say these examples, right, like these data points, these case studies, then they kick off the flywheel, because then when you give this data, hard data, you show, hey, like, here's what's happened here, that brings more people into the fold, more people motivated to kind of repeat this. And so in Sao Paulo, in Rwanda, in Mumbai, all these places, creating these initial case studies with like-minded partners will be the first step of designing the broader ecosystem that can then scale these case studies. And as Anne said, like that progress, showing that progress and showing that it's actually possible, then gives you license internally within your organization to say, hey, like this needs to be repeated and scaled.
Yeah, we have just one more question, but it's actually on this theme taken from Q&A, because we're seeing data is so important for us to be able to monitor our partnerships and ensure that we're holding our partnerships to the standard at which we want to achieve outcomes. But we also need data for health, for our health systems overall. And an audience member had asked that, how do you create trust to share data? Because that's one of the pivotal components that underpins all of this. And so I'm not sure, perhaps Anne or Vikram, since you both were just talking about the subject, if that spurs a thought for you.
Yeah, I think one thing that we didn't touch upon in this conversation, this actually brings up is, when you think about health, there is a healthcare discovery aspect and a healthcare delivery aspect. And like therapeutic development, understanding, CBD, like many of these things, you would maybe categorize that as healthcare discovery, but they are like very tightly intertwined with healthcare delivery. Learning that means that you can actually help a patient, survive longer or catch something earlier. And so the people that play a central role in it, as we talked about, health is a kind of community effort, are, healthcare workers. And in a lot of cases, the ability to actually use data to just deliver better care, to actually have make more informed decisions, even that is handicapped right now. And so I think just ensuring that on the delivery side, we're doing the right thing to empower care workers, caregivers, family members to have the right data in their hands at the right time. That in itself requires this type of work to improve data flow, to improve data standards. And the longer term effect of that will be that you'll actually have much more breakthroughs, much better healthcare discovery prospects. But these are very tightly interconnected. So I would say, like, start in empowering the healthcare workers with the training and the tools and the data that they need to deliver quality care. And in that process, I think you will also help improve our ability to do better healthcare discovery, create more innovation, create more equity. So that really partnering with healthcare workers and care providers will be a really important part of ensuring that data is flowing and is correctly represented. Right now, it's a huge burden for them. Like, there are a lot of programs where you have to sort of write down stuff for input stuff, but it's actually not doing much for their ability to care for the patient or to educate themselves. And so I think that is one of the big challenges that we need to keep real focus on.
Thank you, Vikram.
I think I would even take it one step further, Vikram. It's on also it has to be helping policymakers too. I fully agree with the providers, and when you can improve quality of care, it will definitely motivate everybody to share whatever they can. for policymakers, it's the same. And let me give the example of New York City, for example, or Lisbon. When we talk to the mayor of Lisbon and to the medical director of the city of New York, they are very keen to understand the problems in their populations. So they are very keen, and this is again a partnership with Microsoft, with the big data scientist capabilities of your organization. It's really very very credible and trusted for the government leaders that we want to do this for a goal that is their goal. It's not we who come with the question we want to answer for them. They are defining the question they want to see answered by the data. And in New York, we have access to health and hospitals, for example, the biggest public health system in the US. And the directors of these public health hospitals, they tell us they have really concrete questions, how they can improve outcomes in a better, equal way for everybody. They want to understand what it is, the underlying drivers that make some people have better outcomes than others, even if their biological markers are all the same. So they really want to understand, and then you get that trust, because our goal is aligning to their priorities.
Thank you. We just have 2 minutes left, so that's unfortunately all the time that we have for the questions, but I want to offer such a huge thank you to Aisling, Baptiste, Vikram, and Anne for sharing their lessons learned on building digital health systems, infrastructure, and data pools through collaboration. And what we've seen here is how important that is and how critical it is within health in particular. So thank you again, and thank you everyone for joining us. Just lastly, if you enjoyed the conversation, subscribe to newsletters for future webinars and the latest information on cross-sector collaboration and innovation. We're also coming out with a white paper that synthesizes lessons learned over the past year in inclusive innovation and global health. So we'll share that with you in the coming months. Thank you again to our panelists, and thank you for joining us.